I think the time has arrived. We can catch up later. Okay, first off, the Westford Music Series presents the Olio Romeos. Orleos? Oleos, I got it, like that old stuff that came in a bag and you had to, yeah. And it's at 4 p.m. at the West Common Hall, 21 Brookside Road, Sunday, March 16th, 2025. Do you want to say anything else about it, Marge?
Westford, and all of you know those three guys. They're about our age group, and they're very talented, and they all live up there in Bakersfield, where all those musicians hide these days, and they're very good, and they're funny. We love them. Westford.
Westford, yes ma'am.
Also, the Enosburg Opera House has Friday coming if you want to come dance a jig. It's a St. Patrick's Day celebration, and that's at 7 on Saturday night. So you can have a musical weekend, Saturday and Sunday.
Anything else? Good. Okay. It gives me great pleasure to introduce Kathy Benoit. I have been on the board of Notch for 15 years. I know her well. Kathy has served in the leadership role with Notch for the past 20 years. In this executive role, Kathy has responsibility for overseeing the administration, programs, strategic plans of Notch, which has an annual budget of $40 million with 250 employees. Kathy works closely with and reports directly to the Notch Board of Directors. And with her, I'll let you introduce
Miranda Henry.
Miranda Henry, and she is
Community Services Manager.
Community Services Manager. And obviously, I find this organization extremely important in terms of providing medicine to our rural area. And when Kathy tells you, you're going to be amazed if you don't already know what we do. Kathy Benoit.
Thank you. I'll go right behind here. Thank you for having us. So like Bryant said, I've been with the organization for well over 20 years actually now. I originally started my role as the finance director. So my job was definitely a little different in that role than it is now with the CEO position. But I've been in the CEO position for about 3 years. So Notch, if many of you don't know, has been around for quite some time. Richford Health Center, Inc. is our corporate name. Sometimes people get a little confused when you say that, and that's why we took on a trade name, because they just assumed that we were in Richford. And a lot of people just assume we're still in Richford. And we're one clinic. I actually have people that sometimes argue with me saying, well, you're not the Enosburg clinic. And I'm like, yeah, we are. You're not the Georgia. Yeah, we are. So we've taken on this Notch. We've tried to really brand it as such now so that people recognize that Notch is the organization that has several different sites, several different locations. We're widespread throughout Franklin and Grand Isle County, and we don't just offer medical services, your typical medical services. We offer dental services. We've got 2 locations that have those services. We offer pharmacy services. We have 4 owned pharmacies. Behavioral mental health services, those are embedded within our medical clinics usually. Then the projects that we have, like our social grocery store, our Nifty Thrifty, our partnering project, those are all things that we do that sometimes people don't relate to healthcare, but they're clearly part of your health, social determinants of health. You think about all those things, and a lot of the programs that we offer are to cover those social determinants of health, food and transportation and jobs and all those things that overlap with healthcare nowadays. So it's not typical healthcare 101. It's not what it used to be by far. Here's a map of just where we are located, just to show you how widespread we are. Fairfax is the most southern, being a pharmacy in Fairfax that we own, as well as the health clinic in Fairfax. Dr. Von Lapel has been a standing provider in that community for well over 30 years. She got to the point where she wanted to consider retirement, but she didn't want to leave her community without a provider. But she could not handle being a private independent anymore. There's just too many requirements for a lot of those practices. And that was the same kind of evolution of the pharmacy in Fairfax, whereas Rick had been in that community providing pharmacy services for decades, and same situation, like he was close to retirement, he needed support, and he approached us saying, hey, I don't want to leave my community without a pharmacy, so would you consider taking on those pharmacy services and continuing them? And then you go to St. Albans, where we actually have two health centers. One of them is a transition recently from Northwest Medical Center. In May of 22, they transitioned their Georgia and their St. Albans Health Center back to Notch, because they realized that that was not something that they really needed to focus on. They wanted us to focus on primary care, and they wanted to focus with us focusing on primary care, it gave them the ability to focus on what they needed to focus on, which was specialty hospital care. So that was, like I said, May of 22, and that actually happened originally way back in 2003 with 3 of their practices. So we've kind of come full circle twice with Northwest Medical Center. We do also have a pharmacy in St. Albans, and some breaking news on St. Albans. We're actually consolidating those 2 clinics. We've just came up with an agreement with Northwest Medical Center to buy the Valley Crossroads building. So we will be purchasing that building and consolidating our medical and pharmacy into that location. Long process, 2 years out, but it is something that will be happening in the works. Swanton, we have a medical and a dental practice. We provide both services out of a facility in Swanton. Elberg, we have a part-time medical clinic in Elberg. Enosburg, we've got medical clinic only, and then Richford is where we have the bulk of the services. We have all of our service lines. We have medical, dental, pharmacy, and our grocery store, which we own, is located in Richford, as well as our thrift store and the partnering project. So, we have been a patient-centered medical home since the inception of patient-centered medical home, well over 10 years now. What that does is it really gives us a designation of high-quality care. Federally qualified health centers are something that people might not be familiar with. They hear maybe community health centers. The big difference is federally qualified health centers are health centers that receive federal funding. So we receive a portion of our revenue from HRSA to provide services in areas that are not, they're not part of anyone's catchment area. They don't have primary care services. People have access issues. We have to do a lot for that money. You have to provide certain things like sliding fee discounts. You have to provide a discount for people that are income eligible. You have to abide by their rules for policies, certain policies. You have to allow full access. You can't turn people away. There's a lot of requirements that are associated with that money. And usually you're not there's no competition in those areas. There's no other, usually there's no other way for these people to obtain care for the services that we have to offer. And we do have to offer certain services. You have to offer medical, you have to offer dental, behavioral health. So they're all certain services that you have to offer when you agree to accept this money from the federal government. Notch's mission, clearly it is, we need to promote, preserve, and restore the health of persons residing in northwestern Vermont. So we have to, and we continue to want to provide that care when others are not able to provide it, when you don't have the ability to seek that care elsewhere. There are a couple of our communities that we're in that do have small private practices still operating. There seems to be not as much of an access issue as people might think. We do partner with the hospital, the local hospital, on a needs assessment, a community needs assessment, where it identifies people's needs. And I think the biggest concern that people have is they're often not able to see the provider that they want to see, but they're able to get the care when necessary. So if you're sick, you call your doctor's office, you might not be able to get your provider at that office, but you might be able to get in with a provider within that office. So there's kind of different, I guess, concerns from people. Some people only want to see their provider. That's not necessarily what the normal is in healthcare right now. The normal is that you're taken care of by a group of people. And that's really one of the messages that we try to relay at Notch, is that you're a patient of Notch. You're not a patient of an individual. We welcome all. Like I said, that's one of the criteria that we have by being an FQHC. We accept insurance. We don't just see people that are underinsured or not with insurance. That's another, I think, misconception, that we only see a certain patient population, and we don't. We see everybody. We have actually the majority of our patients are Medicare patients. I would say they're probably about 30%. Medicaid is probably another 30%. And then your commercials are about 25. And then you have the uninsured population as well. We provide full service of medical and dental, physicals, immunizations, the acute care, the laboratory, all of those things. DOT physicals is something that we offer as well. That's a service that actually is very hard to receive in the area. There's certain providers that have to have special education and training that's associated with that, but that is a definite needed service for a lot of the transportation people. Those are all of our medical sites. And those are our medical providers. We've got over 30 medical providers amongst all of our clinics. So it's a good group of people. There's a lot of people that you might recognize that are like Von Lapel and Dr. Hunley and those people that have been around for a long time. But, I think some of the frustration with community members also is that people seem to transition a lot. And, it's unfortunate that we can't keep a lot more providers here in the area. I think we've done a better job of that recently by trying to grow our own. We call it that, growing our own, where we have people within the organization that they start off as a medical assistant. Then they go and get their RN. And then they go and get their nurse practitioner, like their provider. So they grow through the organization. We actually had 2 last year that are currently family nurse practitioners that started out in our care coordination department even. They were in an administrative role. So that is essential to keeping people that are in the community and want to stay in the community. But you need to support them and give them not only the education, but sometimes the financial support in order to allow that to happen as well, which we do. Dental services, I can't say enough about dental services because people think that because we're in a rural area, we don't have high technology dental services, and we actually have dental externs from UNE, which is the University of New England, that come and they extern with us. They stay with us for 12 weeks, 16 weeks. They stay in our dorm in Richford, and they work aside a dentist. And these are people that are officially a dentist. They're just going through the remaining training, kind of clinical training that they need in order to graduate. And they are so impressed with our facilities. They see the advancements that we've made with the technology there. I mean, we're on an electronic dental record. We have pan x-rays. We have the top sensors and imaging, and our facilities are very, very up to date. So it's very impressive when people come in and they mention that to us, that's pretty rewarding that we are able to offer those services. Dental is one of those areas where I would say there is access issues. If you try to get in with one of our dental clinics right now, there is a wait. It's staff related. There are not a lot of dentists in the area, even hygienists, even the aides for dentistry are very limited. There's not people that seem to be going into that industry right now, which is a little concerning. We have been working with the local high schools to try to get students interested in that field. It hasn't really been that successful, honestly. It's one of those areas, I guess, that people are not that interested in, whereas really it's a very good field to get in. So we're hoping to change that and get some new interest. I think, I want to say the BFA Career Center is starting a program to get working with the dental students and trying to get them in that line, that industry, similar to what they do for their medical assistants. But we definitely need some workforce coming into the dental in order to try to keep up with the access and the demands. And those are our 2 dental clinics. One thing I didn't point out was our school-based dental services. So here's another uniqueness that we offer. So we have a dental hygienist and a dentist that actually perform school-based dental services. They go to the schools, they do cleanings, they do x-rays, they do all of those services right there in the school. And I was amazed that actually worked. I thought when they presented this idea to me, there's no way that a kiddo is going to go in there without their mom and want to get their teeth cleaned or even open their mouth. And they actually said it was the complete opposite. They feel very comfortable in the school setting, which makes sense. It's familiar to them. You don't have all this big stuff around you. And they were more compliant. So that is a huge success. We hope that it expands. The biggest obstacle has actually been the facilities not allowing it to happen. The schools just didn't have the space. I can't remember which school it is, but they have it in the library. They throw up the screen and they have one of those zero gravity chairs that they pull in there, and they provide the services in the library. 1 day a week they do that, which is wonderful. But it's a facility issue right now that's preventing it from expanding, really. But I see that as the future of. That makes sense. Go where the people are and provide them those services. So hopefully that gets worked out over the next years and we're able to expand it even more. There's some of our dental providers. A couple of them were camera shy. We're not there. And then pharmacy services. So like I said, we do own 4 pharmacies: Fairfax, St. Albans, Swanton, and Richford. We provide full service pharmacy. You don't have to be a patient of Notch to use one of our pharmacies. They're actually open to the community, and all are welcome. Some of the unique services that we offer in our pharmacy are packaging and medication management services. So packaging, if you've ever experienced taking several medications at once and trying to keep them on a schedule, sometimes very difficult. So the staff in Richford, we have this huge machine, we call her Bertha, and she packages drugs. She's programmed on, if you take drugs in the morning and drugs at noon and drugs in the evening, she packages those drugs so that every day you have a AM, midday, and PM, and it's, you can tell if you've taken them or not. It identifies it. It makes it very easy for you. We provide this service for individuals as well as for a lot of the NCSS patients, the home health. There's all agencies as well that reach out to us saying, we need this patient on a packaging system. So Oh, and we have a drive-through in Swanton. That's always impressive to point out. We bought the TD Bank building in Swanton years ago, and we kept that drive-through. And it's been a huge success, actually, as is any drive-through, I think, for services right now. But that's, people love the drive-through in Swanton. There's staff at all 4 of our pharmacies. And there's pharmacist photos. Got a bunch of them, probably familiar faces. Dave Knight, he still works for us. He's actually going to be filling in our St. Albans pharmacy, so he'll be coming back. He usually fills in Richford only, so it'd be nice to see him. Behavioral health and mental health services. We work very closely with NCSS, who is the local designated mental health agency here. We have staff that we contract with them in order to provide those services within our clinics. It's a very demanding service line. It's very hard to maintain that staff because usually what happens with that staff is they start work, they get their hours in, and then they actually transition to private practice. We see that happen pretty much with everyone that we've contracted with NCSS, which is unfortunate, but at the end of the day, they're still providing those services, so I don't really care if they're part of our organization or if they're just continuing to provide the services in the community. We're still able to refer to them, which we do, and we'll continue to do. So that's, as long as there's that access that can be had by referrals, then we're more than happy to support the private individuals. And I would say that is one service line that has, I would say, taken the telehealth aspect of mental health services is something that has really taken off. A lot of people are receiving those services by video and telephone. It's just very rarely in person anymore, which is another thing that's kind of interesting to me because I would have thought it would have been just the opposite, that those people would have wanted that personal interaction. But it seems like that's not necessarily the case. Care coordination and community health teams are people that we have within our health centers. Each office has what's called a care coordinating team, or one person at least. And those people really provide a lot of different support services. Like we talked about earlier, it's not just simply coming to your doctor and getting your physical anymore. There's a lot of other things that impact your health. They assist with a lot of those other things. They assist with transportation. They assist with scheduling appointments and making sure that you've got a good system and you're on top of all of these services that you need and following up with you. If you were recently in the hospital and you get discharged, they're the ones that call you and say, hey, how you doing today? Make sure you have your follow-up appointment. Are you taking your medication? Those are all things that they help. A lot of help with durable medical equipment. If you're a person that needs those services and you need help, those applications, even the process is very, very cumbersome. The average person would probably not know what to do when they're discharged and they're told to do all these things. They need assistance, and these people, these care coordinators, are those people that help assisting you in making sure that you're compliant in all of those areas. So very essential. The market. Now I'm going to hand it over to Miranda because this is an area that she's very familiar with. I would just preface it by saying that a lot of people are confused on the grocery store and how that overlaps with the health center, and giving a little history about how this all evolved. So in Richford, we're in a complex that's a 4-story building. And the first store has always been a grocery store. And then the second story is the health center, the pharmacy, and the administrative offices. The third floor is housing, which the health center has nothing to do with. And then the fourth floor is our dental practice and administrative offices. And the grocery store has transitioned ownership 3 times? I think 3 times since we've been there. And it got to a point where the last owner said, I'm closing the store, and the health center said, oh my gosh, this is going to create an obstacle for the people of this community. It's going to be a food desert. They wouldn't have had access to the food that we felt was necessary in order to make them, compliant and have access to food. I mean, you need healthy food. So we were given an opportunity to consider, and this is something you have to ask the federal government's permission to do this. You can't just do it on your own. We were granted the opportunity to buy the grocery store in order to retain that service in that community. Keeping in mind that we had in our mind all sorts of ways to make that grocery store part of our big picture, by offering certain things in that grocery store, certain programs that would help not only keep people fed in our communities, but focus on healthy choices, focus on, giving them healthy cooking classes and doing those types of programs. So it integrated nicely with what we felt was one of our responsibilities as a health center.
And I'm Miranda Henry. I'm the Community Services Manager at Notch. I'm very boots on the ground with the Social Grocery Project, as well as some of the other programs that I'll be talking about in a few minutes. As Kathy mentioned, Main Street Market has really become a service line of Notch's. It's become a wonderful incubator site and educational really venue in working with patients and community members. We have a lot of community partners that make that happen. We are also a WIC and SNAP partner for WIC and SNAP beneficiaries. We are very active in the Farm to Plate plan. We work with Farm to Plate consultants, so we're tracking our local produce that we're bringing in and other local goods that are sold at the store, really making a concerted effort to support local economy by working with quite a few local vendors, which we'll talk about a little bit more as well. There's a lot of nutrition and shopper education that we make happen at the store, whether it's through environmental messaging or actually having and hosting activities at the grocery store, which are a lot of fun. I also do one-on-one shops for anybody who's interested in learning what all those little numbers mean, unit prices and all that on the shelf, so helping make healthy, informed, budget-friendly decisions when you're shopping. We also work very closely with our deli team on creating healthy grab-and-go meals. So not only, we always think about what's called time poverty, people who maybe don't have time to prepare a wholesome meal using whole ingredients. So we try to fill that gap a little bit by offering, during weekdays, healthy grab-and-go meal choices are often very plant-forward based on DASH diet or Mediterranean diet principles. So there's a lot going on at Main Street Market. Kathy alluded to, this timeline that we had. This is really, it's more than this. It's more than these five, these 5 points on a timeline. But in a nutshell, February of 2022, the previous owner of the market, Vista Mart, announced that they'd be closing the store in Richford. What that meant for the town of Richford is they're going to become a rural food desert. There's no grocery within a 10-mile radius. Where else can they get fresh food? We have a number of folks who live in the community who don't have transportation. So where else are they going to get their apples? Where are they going to get their fresh meats? So that was really the catalyst for Notch starting the conversation, and it wasn't just Notch involved. Funders were involved. I believe there were about over 24 stakeholders that came together in a convening that spring to talk about a long-term food security plan for the community of Richford. It's not just folks in Richford who shop there. Folks from Montgomery come. We've got folks from Quebec who use that as their main shop site, Berkshire. So it's sort of the greater Richford area. The team worked very hard to secure emergency funding, and we could probably spend an hour just talking about that process, but we won't today. But June of 2020, Notch was able to purchase the store and operate it as a separate LLC until July of 2021, when Main Street Market was able to become part of Notch's 501c3 status. So Main Street Market is Vermont's first nonprofit grocery store operated by a federally qualified health center, blazing a trail. We are very, very involved at the regional and national level in conversations with grocers and other nonprofits who are looking to fill those voids in their community where we see closures. We've had folks from Johnson after the flooding come to us and learn about what we're doing. So I actually have somebody coming next week from Burlington. They work for a nonprofit, and they're going to giving a field trip, exploring our model, talking about logistics, because they're looking at potentially modeling a store after what we're doing here. So we've become teachers at the same time while we're learning. Would you say, Kathy? Lots of great things happen here at the Main Street Market. We've got nutrition education. That's actually a snapshot from one of our SNAP Ed demonstrations. That was funded by the Vermont Department of Health. We had funding for a couple of years to do hands-on activities at the store. We still continue them, but really great program. We teach people how to do quick, nutritious dishes with pantry staples. We take them on shopping tours. We talk about how to read nutrition fact labels. So the store is really just a great place to get really good hands-on experience and learn about what you're buying. As I mentioned, local foods, that's a really high priority for us. We have had some barriers to that. We're beyond the end of the line for a lot of food distributors. So we've had to get really creative, and thanks to wonderful partners like Healthy Roots Collaborative, we've kind of created our own distribution network. So we work with them. They pick up the farm fresh food directly at the farms for us. And when they come, we'll talk about the gleaning program in a little bit, but they actually deliver to us when they're doing their clinic drop-offs or their gleaning program. Without that, we wouldn't be able to get local foods out to the store. So Healthy Roots has just been an amazing partner in helping bridge that gap where the conventional food pathway is not there for us. We work on with a number of partners on social programs. Age Well is a big partner of ours. They come out once a month and do SNAP Ed outreach. They also do a lot of, we actually just did a little video with them that should be coming out pretty soon to talk about Free Squares and a SNAP, that program, and all the wonderful benefits of shopping at places like Main Street Market and your other independent stores using your benefits. Those trolleys there, has anybody seen a green walk to shop trolley? I'm not sure if there are too many in St. Albans yet, but that's a project of Net Zero Vermont. The Walk to Shop program. Through grant funding, we're able to bring in these deeply subsidized, very wonderful and practical shopping trolleys. This came out of a conversation we had. Our grocery carts were going missing. Why is that happening? Because there are people in town who need to purchase their groceries but don't have a car. So we've made these very affordable. What would cost you about $100 online, we only charge $15. So a really, really great economical solution for quickly and conveniently and safely transporting your groceries. I had one family tell me they saved about $150 a month because they're able to shop more economically using their trolley. So just hearing things like that makes that partnership all the more powerful. One of our favorite things that happens at the store is we have the local schools in to do field trips with us. We use USDA My Plate education, and there's often a hands-on nutrition, culinary education component that goes along with those. We do love environmental messaging at the store. If you come to our store, you'll see we have little shelf educators that might tell you a few facts about brown rice or quinoa or broccoli. And we often have recipe cards to accompany those with quick and easy recipes. As mentioned, we are SNAP and WIC partners, and we also perform quite a bit of outreach there through partners and our own initiatives. So this all ties into our work around food is medicine. It's sort of an emerging and developing definition, but the idea that food can help manage our conditions and heal our bodies is sort of the foundation of this. So access to nutritious foods like the fresh produce and the fresh lean meats that we offer at Main Street Market are sort of part of this accessibility of food as medicine. One thing that we rolled out back in 2022 across all of our clinics was the hunger vital signs screening. So if you're a Notch patient, you may recall being asked these two questions about food in your household. This is a responsive tool that we use to identify people who maybe are experiencing food insecurity or nutrition insecurity. We have developed some great programs to respond to folks who have maybe screened positive for these 2 questions by developing some food as medicine interventions. Back in 2022, we piloted a grocery store retail-based medically tailored grocery bag program, and we also have one that we're operating right now with our friends at the Sheldon Methodist Food Shelf. So folks who are eligible, meeting chronic condition criteria, as well as that food insecurity, positive food insecurity screening, may be eligible to participate in these programs where Notch works with our partners to curate these condition-specific, medically tailored food bags that they can then take home. We give them some education, some recipes, and we invite them to participate in our hands-on cooking classes as well, to help get some nutritious food into their house, help them work with budget-friendly foods, and nourish their bodies. A couple of other programs that we are working on are produce prescription programs. So since 2022, we've been working with our good friends at Healthy Roots Collaborative on a produce prescription CSA. I believe there used to be one that ran out of NMC, but we're sort of the latest version up here. And that we were able to serve patients across all of our service sites with this program, which is really exciting. And then we are the recent awardees of the Gusnet Produce Prescription Program. So we are in development with the Next Generation Produce Prescription Program, which will allow folks at the point of sale, and we're using Main Street Market as our incubator site for this. They essentially have a card that has their prescription dosage on it. It might be $20 a week for a year to buy fresh fruits and vegetables at participating grocery stores. So we're in the process of getting all the technical aspects set up for that program, and we hope to start enrolling folks in the second half of the year. So this is a 3-year project, and we're hoping it's something that can be replicated across other sites. So really exciting. We're the first Gusnet Produce Prescription recipient in Vermont. Very hard work getting that funding.
3 years.
3 years, yes. With that, we have companion culinary education. As you can see, we reach people at all ages of life here. We've had folks in class who are 1 year old. I think the oldest participant we've had in class was 96. So as you can see, we reach a lot of folks in the community. We have partners all around the region. We go to libraries, we go to schools, we go to housing sites. Look for our flyers, or I'll leave my card out. You can contact me about our latest scheduling. So the thrift shop, I'm switching gears a little bit because I could talk about food all day. We're probably all getting hungry as we're nearing the lunch hour here. One of the wonderful things that we offer here is sort of talking about the spectrum of social determinants of health is a thrift shop. Has anybody ever been to the Notch Nifty Thrifty in Richford? It's an absolute gem. I'm wearing some apparel from there today. It's just a great place. It's all donation based. So everything in there comes from the community. We're able to serve folks through, we have a lot of regular shoppers, and we also partner with other agencies like Voices Against Violence and the local schools. So if there's a family or an individual in crisis, we're able to help provide them with some essentials for their next step in their journey. We're also a job training partner site. We've worked with Vermont Jobs Associates, and actually some of those folks have become employees of ours, which has been a wonderful, wonderful pathway for getting folks some work experience and getting them back into the workforce. We always have free stuff outside, so we have a number of folks in the community who shop the free rack every day. And we also have a dollar room, and we're always running sales. So I do recommend if you're in the Richford area and you can hit us during our open hours to stop on by, because there's really something for everybody there. And then right next door is the Notch Partnering Project. And this is sort of a satellite spot for a hub and spoke model for a number of agencies in the area. So we currently work with Economic Services. We have reach up there just about every week. We've recently brought Champlain Valley Office of Economic Opportunity up there. They are actually overseeing the Richford Food Shelf right now as well, which has been a really wonderful partnership. Hireability is one of our main partners. Howard Center's up there providing services on a weekly basis. Turning Point hosts meetings there. The building pretty much turns into Turning Point on Wednesday. And then we have the Department of Health operating WIC clinics. So it's a really busy place. We also, I'm there from time to time. It's part of our community health work. We'll also meet with community members and help them with referral to services. So we have sort of an open door policy there, and these agencies are just wonderful, wonderful partners in bringing services out to this remote corner of the Franklin County area. If you have any questions, Kathy and I are very happy to field them after this presentation, but we're here now and we have some time to address anything you might like to ask. Yes?
How do you interface with the home health agency?
So home health, as we all know, has transitioned to
How do you do?
VNAH, what's their acronym?
There's an S in there.
There's an S in there as well. So we work closely with them. Our care coordinating members are actually on a regular, they have regular communication with the home health nurses. They collaborate as far as getting care for those patients started, as well as ongoing care. One of the problems right now that we're seeing with the home health is that they're very limited on the services because of staffing. They continue to have shortages, and a lot of these patients are having to be transported to one of our clinics in order to get the services that they need. Wound care, I would say, is one of the major issues that they're seeing, being a service that they can't keep up on. So we've been working closely with them in order to make sure that we can get them the care that they need in one of our clinics. We cannot send out nursing staff to facilities. We can't send them to residents because we're not able to do that because of liability reasons. But we, like I said, the back and forth communication is essential. We noticed that communication has kind of gone a little to the wayside with the transition, but we're hoping that it's just a matter of trying to regroup and become familiar with each other. And what they're able to provide and what we're able to provide, and make sure that there's no gaps in the coverage. So, but it is one of the services that I would say I was very concerned about. As soon as you hear transition, you're like, oh, I don't know how this is going to pan out, but I do think that they've got good intentions and they do have focus on our area. They haven't just, been so large, and it's going to take them a little bit of time, and they have retained a lot of their staffing, so which is good. But we collaborate closely with them. Lots of hands.
With the current situation in the federal government and our funding being cut, is it not in jeopardy of losing funding, and is there a contingency if it does?
I wish I could tell you definitively, one way or the other. I don't think I can tell you. I can tell you what my gut tells me. We have support on both sides on the federal level. We always have. We've proven ourselves, and I think that's the most important thing. When you can show that you provide valuable services, you're going to be supported. And I feel like we're going to continue to be supported. Is our program's going to change? Absolutely. I'm not oblivious to things needing to change. But I don't think that any of our core services are at risk. There were some recent articles that they came out in the last couple of weeks here saying that we're, as health centers, financially not stable. That's not the case of our health center. We have surrounding health centers that are financially unstable for various reasons. Burlington being one of them, and they've made that very vocal that they're in a financial crisis, I would say, but it has a lot to do with some of the services that they provide that we don't provide, and their patient population, really. They have a very, very diverse population. I think they said they have 60 languages that they provide, their patients have, whereas we, very, very few. I mean, very few.
Three.
Yeah,
It's our three
yeah, so
primary.
we don't have that same diversity. So we're not able to, or we don't have those same concerns and those same costs and those types of things. But, there's a couple of things that will be delayed, I think, because of changes in the administration. We've had systems, for instance, that have crashed because they've put a hold on them and then you can't re-access them. We've, so very, very limited operational issues thus far, but we are preparing ourselves for some things that we know are going to probably come and impact us. But, you as a community can be assured that, we are a very financially sound organization and we will continue to provide services here for quite some time. And we have very good working relationships with our partners, being Home Health, NCSS, the hospital. We all support each other. We all know that we all have a specialized service line, and we all do business well in those service lines. But we work collaboratively together. So as we need to. I mean, that's what your community needs. You need, some people think that we compete with each other. We absolutely do not. We absolutely do not. There's plenty of need out there for each one of us, and we need to just focus on what we know, and we'll all be fine.
My question sort of piggybacks on that. What percent of your budget is from federal grants?
Very, very little. So our federal 330 DACE grant is $2 million. So $2 million out of our $40 million, actually $45 million now, budget is federal.
I don't have a question, but I have an anecdote to share with you. So getting back to the food is medicine thing, a few years ago, my wife and I donated quite a bit to food shelves. So I went into a food shelf one day and I had something unusual for this year. It was a giant kohlrabi, which we either slice or we make little sticks for coleslaw salads. And so I told the woman, I said, I'm willing to cut this up or shred it into bags and stuff, or into sticks. And I said, I'm even willing to come in and demonstrate to people, not just this particular vegetable, but some other stuff, maybe cooking simple meals and stuff. And she said, I don't think you understand the population we're dealing with. She said, I had a young mother, so it was a teen mother, who said, my daughter loves carrot sticks she gets them at school. Can you give me the recipe? So we don't fully appreciate
You do not.
the level of need
Yeah.
that's out there for that niche.
And that's so that's the value that some of our programs add that people take for granted. I mean, I don't bake nearly as much as my mom. I won't claim to, but I do understand the basics of cooking, and there's a lot of people that don't have that basic cooking. They don't know how to cook a potato.
Even making something like soup, which is one of humanity's greatest inventions.
Yes.
I mean, it's so flexible
Yeah.
and so nutritious, and yet they have no clue how to make it.
Yeah.
Yes.
I have a question about medical providers. Within the last 5 years, my husband and I were seeing private physicians who were then joined Notch. And in the last 5 years, we have lost 3 providers. What efforts are being made to find more MDs and DOs?
So right now, we're actually fully staffed for our medical providers. We're actually overstaffed.
You have 4, as I recall.
No, medical providers, we have 30.
No, I mean not mid-level providers.
Okay, you're MDs,
MDs.
MDs specifically. I thought you said mid-level, sorry.
No.
So I can tell you that physicians are extremely hard to obtain and retain. We have a standing physician opening. We have a lot of competition for those positions. As a rule of thumb, Notch has a minimum, I would say, of docs that we have to have in order to supervise all of our mid-level providers. So a mid-level provider, for some of you that don't know, is a physician assistant or a family nurse practitioner. So those staff people have the same authority as a physician. They can literally do everything that a physician can do. The difference is their education and training. So that's the difference. So they need the support of a physician. But we have some well-seasoned mid-level providers. Stacey Bouchard. Stacey Bouchard is a mid-level provider, and she's been practicing for well over 20 years. And we have a lot of those mid-level providers that have that training. So really, it's, you know, you've got that aspect of it. But it's a retention thing, and it's very hard to you know, to be competitive and even have physicians that are interested in working here unless there is a specific reason why. And this is why it's very important to retain the ones that are in the area, but they're essentially not going to stay here unless we can give them a reason to stay here.
Could you further explain, I know there are some health providers here who know more than I do, but the difference between an NP, a DNP, an APRN, and PAs in training and education and licensing?
I can't tell you entirely, but there's a doctorate of, which really is the education piece of it. So Lynn McMorrow, if you're familiar with Lynn McMorrow in the Enosburg Clinic. So Lynn McMorrow is a doctorate, she has a doctorate degree, but she's a family nurse practitioner. So there's the difference, and actually we've got a couple of other ones that have doctorates as well. So it's the educational aspect that labels her a doctorate nurse practitioner. The difference between nurse practitioners and physician assistants, actually, there is a big difference between those two, whereas the nurse practitioners have that nursing background. There's that training as a nurse that brought them through the stage of becoming a family nurse practitioner. But there's the entire difference between all of those things is usually it's an education aspect of it. And
contrast that with the training for an MD.
Yeah, so an MD has, I believe, twice the number of hours of training than a mid-level provider.
And
Twice.
so why?
It's similar to, not exactly, but about.
I'm just concerned that with 30 mid-level providers and 4 MDs and DOs and staff, that we're not getting the medical attention and care and expertise that we were able to get 30 years ago in Franklin County. We had a plethora of internists, medicine.
But take into account some of those, like I said, the mid-level providers that have extensive training.
But they don't have the training the MDs have.
They don't, they don't have the same type of training. As far as I'm concerned, they've got better training because they've got on-the-job training. There is nothing any better than, and you talk to a new graduate. Like I said, we've been growing our own. So there's 2 graduates in Enosburg that I would specifically relate this to them, Pam Jacobs and Kate Kaswitz. So both of them were RNs working for Notch. They proceeded with their education, they graduated, family nurse practitioners. They come into the clinic and they said, oh my gosh, we were never told that in school. We were never trained that on our clinicals. They did not get that expertise in the training that you would have thought they would have gotten through their school. They got it on the job training under our provider.
My sons and others just transitioned to a new job, so.
Yeah.
But I think the medical education and experience in clinics and hospitals and locations is valuable.
Yeah.
And really hope that Franklin County could try harder to. Who's in charge of recruiting doctors in the county? Do you know?
We specifically have an HR director that is in charge of the recruitment of staff. And like I said, we have a standing opening within our organization for physicians.
And I'll just add that this is the landscape across the country.
This
This
is.
is, primary care is mostly mid-level providers.
Mhm.
AARP actually just had a really great article about this. So if you read AARP, I think it was, may have been last month, talking about how this is the way of the future. As Kathy mentioned, they have all the same capacity as our physicians, but yes, the training's different. But I'm thinking of Pam Jacobs, for example. She's coming in as an NP with a strong gerontology background.
And that's, sometimes they specialize in certain areas, which
Yeah.
is also very good.
Yeah, Dennis has
Very
a
good.
surgical background, so yeah, they're
Yep.
coming in with some specialty training as a result of their hands-on experience nursing.
Psychiatric nurse practitioners is another interesting area that a lot of them have been pursuing.
Electricians, plumbers, you name it, have to pass a license to.
They've got boards.
Have to be board certified?
Yep.
Is there a consistency among the tests? Because you look at the bios and it looks like there's several different certifying organizations.
Yeah, you do have to pass your boards, which are a state authority, in order to get licensed within the state.
I'd like to make a comment, a little bit because of my background in healthcare. I am retired, obviously, at this age, but I did get a master's degree. I ran the home health agency here for a number of years. And I've also taught at both Georgetown and UVM in nurse practitioner programs. And what I would say to this whole movement that is, and Marge can probably speak to this, and Mary also, this whole movement has been in a very positive direction as far as I'm concerned. My own personal experience is that I've had more time and attention from either a PA or a nurse practitioner than I've ever had from a certified medical doctor, be they a DO or
That's good to hear.
medical doctor. And I will also just add, I have a brother who is a retired general practitioner. And one of the reasons he left medicine practice was the pressure that he was under in terms of time frame. Every 10 minutes he had to be seeing a new patient. And he had to depend on the nurses in his office to be doing the educational piece that is so important when you have healthcare issues. And that was driving him crazy. And he really came to believe in how important the education of PAs and nurse practitioners were, because there is a scarcity of doctors. And the right hand needs to know what the left hand is doing. And to be honest, back in about I won't tell you when, I actually was in charge of a program that was between University of Vermont, the health department, and the Burlington Busy Nurse Association. And we did an experimental program. We had 9 doctors and a nurse from each of their offices who came. The nurses came once a month for 3 days for advanced training. The physician came on the 3rd day, and it was the first nurse practitioner program in Vermont, and it was before there was credentialing for folks. So historically, this has been coming for a long time, and I'm particularly excited to see how well it has taken off and how incredibly well educated our mid-level people are.
So the same concept is happening with dental services. I'm not sure if anyone is familiar with that, but they're actually, what do they call them? A dental therapist, which is odd because it's a mid-level dentist is what it is basically. And this has been something that unfortunately COVID pushed it back. I want to say to the beginning. This was supposed to be implemented in the state back in well, just before COVID, so in 2000. So it has not evolved as we would hope, but really it was meant to address the access issue. You don't have enough dentists to provide the services that you need in the state by far. I mean, you are short. And the only way that you're ever going to catch up is if you allow this to happen. And it's not that it's bad. You know, people associate mid-level with not necessarily up to a certain level, but that's not the case. I mean, with the education that you're able to provide them and the experience that you're able to provide them, you will get them very familiar with just the community. For one, it's a community thing. You know, you need to understand conditions in your community and the members of your community and what they're facing. And there's no better way to get that knowledge than to experience it hands-on. So that's why I feel like Notch is an organization that really supports training and education and staff and investing in them to make sure that you know, we can continue to have these services in our communities. Because we need it. There's just not enough doctors, there's not enough dentists to be able to serve and meet our needs if we continue to not allow these things to happen. So.
Different tact. Can you tell us a little bit about how and who started Notch?
I can. So back in 1962, that's how old the organization is. There was a donation made in order to start a program in Richford that provided healthcare services. Janet Reardon was the person that donated her house in Richford. It literally is a house that we started in Richford. And she donated that house, and there was a sign that was put out, and I should have brought it. It actually says "Doctor Wanted." And the joke was that they thought the actual name of the doctor was Wanted because it was out there for so long that people just assumed that was the doctor. So, you know, there was a couple of people that just were willing to put time in and volunteer actually at that clinic. And then in 2000, the hospital actually approached the health center, which was operating as a rural health center, and they approached the health center, the board of directors actually, because there was no staff people. So Pam Parsons, Carolyn Coons, and Marcia Perry. And they said, do you think that you guys would be interested in turning this into a federally qualified health center? And at the same time, would you be interested in taking on our Elberg, Enosburg, and Swanton practices? And that would make you a competitive force. Like you would hopefully we'd be able to get you this funding in order to get you started and provide these services in all of these communities. So since that time, it's just evolved into what it is now. But yes, we've been around a long time, but it was at the vision of a lot of community members that identified the need, and they took advantage of what was available to them in resources, and luckily they had a partner like the hospital that was really able to help them, because the administrative aspect of becoming a federally qualified health center is not easy. You know, you have to deal with a lot of different agencies, and you have to be extremely well versed in that whole process of getting that done. But it was done because you had some people in the community that were adamant that it was going to get done. So, and it did.
One last question for.
I just want to make a comment about sorting out care. And we're talking primary care for the most part in these clinics. And a lot of these mid-level people are very well trained in primary care. If they have a question for diagnostics, they often do talk with the physician. And the other thing is, in our new society, we are becoming tier-oriented, and specialists are helping out, you know, general practitioners all the time, and family practice professionals, that we often will find the same thing when we go to our primary care physician at the medical center in Burlington. They are in a minute referring on to a specialist. And I think that is the whole system. And these mid-level practitioners are very well versed in picking up anything that's abnormal. They may not know the total diagnostic pathophysiology related to it, or they may, but they do know enough that probably this person needs a specialist. So I feel pretty comfortable the system is adapting as best they can, because those of us who have physicians in our family know that they are disappearing for a lot of the reasons Denny was pointing out. When you're told you have 10 minutes with a patient, you don't do a lot of other stuff you need to support them. So they are leaving, they're exhausted, they're tired. They can't afford the insurance to be a private practitioner anymore because everybody is suing them. I don't know, it goes on and on. So they are disappearing, and this is a whole new system.
Yeah. Thank you.
Just one little story. I just had my physical, and I had a physician assistant do the main part. And I've been going to Notch since 2004. This physician assistant was the first one who ever said, "Do you know you have a heart murmur?" I said, "Yes, I knew that when I went into the military. They told me I had a heart back in '65. But I just was wet. All those years, no one ever pointed out that I had a heart murmur. And he came in, boom. So, obviously I'm sticking with it.
It is, you know, and some people, I mean, I think we need to be realistic in understanding what it is when you're a provider and how difficult it is, because very frankly, they're not perfect. There's things that could easily be missed. There's things that you as a patient inadvertently don't disclose and you don't understand the impact on your healthcare. But no one's ever 100% right. You know, there's oftentimes that something's gonna be missed. And frankly, there's providers that have to really decide, you know, how deep do you wanna dig into someone? Because at the end of the day, if you dig deep enough, you will find something, which is not necessarily a good thing. You know, so there's, you know, we're all headed in the same direction.
That sounds like a good closing argument. Kathy, thank you.